Testing thumb MP extension. You'll have your patient's hand in a neutral position while resting on a flat surface or table as shown here. The first thing you'll have your patient do is extend their thumb towards the ceiling as far as they can go and bring it back down. Because she was able to do that at this joint, this is the joint we're looking at here, the MP joint, we would grade that as a 3. To test for 4 and 5, I will stabilize the first metacarpal and apply resistance to the proximal phalanx. But first have your patient go downward with their thumb about this way and then have them come up and do extension. So resist me, 3, 2, 1. If the patient cannot bring their thumb into full extension while in gravity eliminated position as shown here, if they can only come up halfway or whatever, we will grade that as a 2 because there's no gravity eliminated position for this extension. If they cannot do any movement of extension at this joint while in this position, then that will be a 1, and you will palpate for the extensor pollicis brevis, which is found just distal to the MC joint here, because that's where it attaches at. If you feel any movement, that is a 1, and if you do not feel any movement happening at that joint, that is a 0.